Let's go over some of the main terms in the male anatomy. First, we have the gonad of the male, which is the testes right here. It's basically a sperm factory. It also produces testosterone. There it is right there. It's encased in a sac called the scrotum. The scrotal sac allows the testes to hang outside of the body to stay cooler. If you don't know, the reason that happens, it's not because the males have a perfect off switch. It's to keep the sperm cool, because if the sperm gets too warm, it's lethal. It'll kill the sperm. So, go figure. It turns out the Scottish had the best idea all along, where men should be wearing the skirts and women should be wearing the pants. Anyway, on top of the testes, we have what's called the epididymis. So again, it's a sperm factory, and there's these elaborate tubes in here where the sperm is generated, and the tubes continue through the epididymis, and then they follow it all the way out along what's called the vas deferens. So the vas deferens is this tube that gets the gamete, the sperm, ultimately all the way up and through and out the penis for ejaculation. Okay? If someone undergoes sterilization, surgical sterilization, they have a vasectomy. And a vasectomy is when a surgeon can go in and can cut the vas deferens on both sides, snip it, they cauterize the ends, burn them shut, and they tie them off, and then so no sperm comes from here out the penis. The semen can still come out this penis, so a man can still have an ejaculate, but there's no sperm in there. The sperm doesn't build up. I mean, it does to a certain degree, but if it's not used, it'll be broken down and recycled. So, from the vas deferens, we come up here to several glands. We have the bulbourethral gland right here. We have the prostate gland, and we have the seminal vesicle. All three of these add to the notion of semen. The semen is the fluid that a man ejaculates. Within the semen is sperm. But what's also in the semen, we talked about early in the semester, is pH buffers, lubricating mechanisms, fructose, stuff like that, to keep the sperm viable. So, comes down, here's the bladder, where man stores his urine, and here's the urethra that comes down from the bladder. The urinary tract goes to the urethra, and so as you can see, both sperm and urine pass through the same tract. The argument for that is urine is sterile, and so in that way, urine sort of cleanses the pathway of the penis and prevents any bacteria from forming. This is also the ejaculatory duct right there. Okay, so that's the duct that comes from the seminal vesicle, so the semen is intact now, and from here on, the semen and the ejaculate can be relieved. The penis right here, the extension of the penis, you see it has an enormous amount of spongy tissue, and it's filled with blood vessels. And so when a man gets excited and gets an erection, those blood vessels, the spongy tissue expands and traps the blood in the penis, and that's what allows a man to stay erect. At the end of the penis is the glans penis, or the head of the penis. This is the most sensitive area of the penis. It's similar to the clitoris, the glands of the clitoris we'll talk about later. And then you can see a covering. On uncircumcised males, you see skin covering the entire width of the glans penis up to the very top. And of course, if a male is circumcised, this portion of tissue is cut back and stitched around the corner. Well, actually the lower. Okay, so those are the main components of male anatomy.